And this shows the proportion of women who attended Medicare in the public sector. What do we do with the private sector? As long as that malaria medicine comes. Professor
Muhammad Ali Pate, the one I call Better Health Outcome.
Well, thank you. The Honourable Minister of State for Health, Dr. Tunja Lausa, distinguished Senator Dr. Harry Banigo, the Chairman of the Senate Committee on Health, my brother Dr. Tedros, it was good to see you just now, who is also joining us, along with Dr. Moeti, Regional Director of WHO, our partners that are here. I think I've seen Global Fund, Gates Foundation, Aliko Dangote Foundation, several members of the National Assembly, the Governors Forum, senior government officials, the US government, and all the distinguished partners that are here. So thank you very much for coming. We're very pleased to have you. I'm not making a speech. I think today is not for long speeches. I want to thank you for accepting our invitation to come and discuss rethinking malaria elimination in Nigeria. Before I just make one point, I would like to ask in this room if anyone is really satisfied with the state of malaria control or elimination, and just raise your hand. I'm looking. We've been making progress. It's not as if we have not made progress, but are we satisfied? Okay. I think the numbers are clear, and I see that we are not satisfied. It is out of that dissatisfaction, and also prompted by many conversations we've had over the last several months. And here I'm very grateful that Her Regal Majesty, the Ambassador for Malaria in the southwest part of Nigeria, Dr. Temitope Enitan Ogunwusi, is also here with us on behalf of our traditional leaders, that we're here to rethink our trajectory on malaria elimination. After 70 years of an effort, after lots of resources, yes, we have made progress, but we are not satisfied with where we are. So as we hold this round table, we should think, how can we be more efficient in deploying the resources, technical, human, and material resources to do better? How can we be more effective to achieve the improvements in health outcomes with the instrumentality of malaria giving its burden? How do we do that? Be more equitable so that we don't leave people behind. So that it's not those of us that are in Abuja, but every Nigerian has a fair chance to have malaria prevented and to be treated. How do we row in the same direction, consistent with the President's direction to improve population health outcomes? How do we align our efforts, coordinate better, and achieve our objectives? With a diversity of tools available, how do we optimize them geographically, but also among the tools? How do you combine them in a way that gives us, stretches the combined effort to achieve more results? What are those shifts that we need to make from the status quo, which is not satisfactory? How do we make those shifts? And I'll be very much looking forward to the conversation to understand what are those things that we need to do. Who is going to do what, where, when, how, and how do we tell that we're making progress over time? So I want to assure you that this conversation is an integral part of our collective effort in the Health Sector Renewal Investment Initiative under the direction of the President to ensure we change the narrative, change the story. And I count on all of you to be candid, to challenge the status quo, but be forward-looking. I think whatever is past, but going forward, what do we need to do differently? So thank you very much, and you're very welcome to this roundtable. Thank you.
you, MC. To the Coordinating Minister of Health, Professor Ali Pate.
For the objectives of this important meeting. Thank you.
Thank you very much. The Honorable Coordinating Minister for Health and Social Welfare and all other protocols duly observed. I just wanted to give you an insight, not necessarily reading everything about the objectives, but to give you an insight into what we are here for today. So today, we'll be looking at the current situation that includes the entomological profile for this country to understand what the issues are and the implementation challenges. We'll also be looking at what the efficacy and effectiveness of current and future tools, and then we'll also be asking ourselves the issues that has to do with defeating malaria with focus on success stories from other countries who have successfully eliminated the program, and then we'll be also go through the essence of how do we move forward in this country concerning the elimination of malaria in Nigeria to a time when we'll see that progress has been made profoundly. So on that note, I just want to say thank you very much for coming, and we wish ourselves a very fruitful deliberation. Thank you.
And Nigeria has been involved in all the measures that have been taken. As earlier in Sub-Saharan Africa, in that studies, it took 7 years, the project, and several findings were global peace. And we can see the trend from the year 2012, how it has gone, almost parallel, not making significant progress.
All welcome to this auspicious occasion. The Honorable Dr. Adebayo Benjamin Lani, he is the manager. We should look forward to see our partnerships or where we are in terms of.
I am delighted to welcome you all to this ministerial forum on rethinking malaria, which will provide us an opportunity to assess the current malaria situation in Nigeria, evaluate the effectiveness of the existing tools in addressing the malaria scourge, and to rethink the approach, the factors facilitating or mitigating the progress towards the elimination of Nigeria in our dear country. We are gathered here today and we are reminded of the devastating impact of malaria as it affects us as a people. And inasmuch as malaria is a preventable and treatable disease, it remains a leading cause of illness and death in our country. However, the country has made some progress over the years. The WHO, World Health Organization, has estimated that malaria incidence has reduced by 26% since 2000, from 413 per 1,000 population in 2000 to 306 per 1,000 in 2021. Within the same period, malaria mortality rate, that is deaths per 1,000 population at risk, fell by 55% from 2.1 per 1,000 population in 2000 to 0.9% per 1,000 population in 2021. Distinguished ladies and gentlemen, we must prioritize prevention, strengthen our health systems, and ensure access to effective diagnosis and treatment for all. It is indeed not a compliment that Nigeria bears a third of the global burden of malaria, with the country accounting for 27% of global malaria cases and 31% of global deaths, based on the 2023 World Malaria Report issued by the World Health Organization. And consistently, we have maintained this position. From 2009, I beg your pardon, till date, more than 230 million insecticide-treated nets have been distributed in the 36 states and the Federal Capital Territory. But according to the 2021 Malaria Indicator Cluster Survey, the proportion of the population who slept under the insecticide-treated nets the night before the survey increased from 22.9% in 2010 to 36.4% in 2021. And the percentage of children under the age of 5, that's the most vulnerable group, who slept under the ITNs the night before the survey increased from 28.9% in 2010 to 41.2% in 2021. Among children who were reported to have had fever 2 weeks preceding the household surveys, and among those who sought care for fever, the percentage who received the blood test did increase from 6.5% in 2010 to 39% in 2021. This data is necessary as we begin to discuss and talk about malaria and how we can eliminate it. Distinguished ladies and gentlemen, I stand before you to say we need to rethink our approach to malaria, how to control and eliminate it. We need to challenge our assumptions, innovate our strategies, and collaborate more effectively. I want to use this opportunity to thank all our esteemed distinguished development partners, both local and international, civil societies, and other line ministries who are working in tandem with the Federal Ministry of Health to reduce the burden of malaria in Nigeria. Finally, on behalf of the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, and the Honorable Minister of State for Health, Dr. Tunji Alausa, I wish to welcome our esteemed guests from far and wide, who have come to Nigeria and who are already in Nigeria for those who are here, and to the seat of government, the Federal Republic of Nigeria, Abuja. It is hoped that by the end of Rethinking Malaria Forum, that you'll find time to visit the city if you have never done so before. Enjoy the sights and sounds of Nigeria as I welcome you all to this Rethinking Malaria Forum. Thank you for your kind attention, and may God bless the Federal Republic of Nigeria. Thank you.
On how to eliminate malaria from our country and help surrounding African countries to do the same. Also, to our amiable Permanent Secretary, who has been the engine of the Federal Ministry of Health, Daju Kachelo, MNI, thank you for all the hard work that you've been doing. Sorry, I forgot the Deputy Chairman of House, I think he stepped out, representative on ATM, AIDS, tuberculosis and malaria. Olori Temitope Enitogunwusi, thank you for all your work on malaria. This has been a life journey for you, and thank you for coming today to add to the importance of what we're doing today. To all the Federal Ministry of Health directors and agency director generals that are present here today, and let me particularly thank Dr. Moeti for being here today and for all the things you do for the entire world and Africa more particularly, as well as Joy Pomafi of Harman. Thank you for coming. And also would like to extend my courtesy to all our development partners, both bilateral and multilateral. Thank you for all the support you've been giving our country. But now, we need to coordinate this support in a better way, that we can begin to get better results that our country as a sovereign nation wants and desires. We will do it in a very collaborative manner and a respectful way. I also like to thank the members of the press that are here today. Ladies and gentlemen, good morning. It gives me a great pleasure to welcome you to this auspicious forum, which aims to draw global attention to the lingering burden of malaria in Nigeria and encourage necessary actions to check this scourge. Later part of last year, President Bola Ahmed Tinubu announced that strategic blueprint anchored around Nigeria's progress in universal health coverage is geared towards saving lives, reducing both physical and financial pain, improving population health outcomes, accountability, maternal and child birth, and also to improve governance in our healthcare system and also ensure we deliver affordable and quality health services to all Nigerians. Against this backdrop, this meeting is organized to rethink malaria elimination in our country, Nigeria. About 60% of all hospitals attendance in Nigeria today is due to malaria. The disease contributes about 30% to our childhood mortality. There's hardly any aspect of our daily lives that is not affected by malaria, which has consequential effect on productivity. The disease has indeed remained a foremost public health challenge. Nigeria has witnessed some reduction in the prevalence of malaria since introduction of some intervention, such as the use of long-lasting insecticide nets and the use of artemisinin-based combination treatment for the treatment of uncomplicated malaria, as well as the introduction of chemopreventive therapy for pregnant women and children between the ages of below the age of 5 years. It is, however, disheartening that despite all these effects, all these efforts, malaria remains a considerable burden in the country, affecting all age groups as well as unborn babies. The performance appraisal of the National Strategic Plan 2014 to 2020 showed a modest drop in parasite prevalent rate from 27% in 2015 to 22% in 2020. However, the midterm review of the National Malaria Strategic Plan of 2021 to 2024, conducted in 2023, similarly showed an unimpressive performance. I repeat, unimpressive performance and a clear demonstration that continuing in the same business as usual mode may never give us the desired result. A few months ago, we sat with our National Malaria Coordinator, National Malaria Elimination Program, and we posed a question to him. If we continue to do what we're doing today, would we be able to eliminate malaria in 100 years? And his answer was very unequivocal. It was a resounding no. That's why we have to change the course. We have to go back and retool, redial, rejig, and redirect and refocus our efforts in a different way that will lead our country on the path of malaria elimination and not malaria maintenance. It is gratifying to know that fits perfectly into President Bola Ahmed Tinubu's agenda of redefining healthcare delivery in Nigeria and a desire to provide qualitative healthcare to the people of Nigeria. We're not unaware that malaria is a moving target. As a people, we're determined to put in place an enabling environment and structures for our development partners in service delivery and other support that you may require from the government of Nigeria to help combat this menace of this disease that has lingered on for so long. About a month ago, a ministerial conference was held in Yaoundé, Cameroon, for the high-burden, high-impact countries. Nigeria participated in this meeting and committed to supporting all processes, interventions that will facilitate the elimination of malaria in Nigeria and its neighboring countries. In this renewed commitment, we're determined to scale up all interventions that added value in the past. We will bring on board new interventions that will facilitate malaria elimination in Nigeria. To this end, I call for your invaluable and well-informed perspectives on accelerating malaria elimination in Nigeria. It gives me a great joy to state and acknowledge that the robust Global Malaria Program partnership that still exists after so many years is growing more robust and making tremendous impact in the fight against malaria. Many partners from within and outside Nigeria have immensely and remarkably supported the ministry as well as the government of Nigeria, and this support is deeply appreciated. We're committed to sustaining this collaboration through which significant resources have been expended and numerous activities aimed at controlling malaria in Nigeria have been undertaken. It is time to change the narrative about malaria in Nigeria and by extension the world. The government of Nigeria is also committed to more domestic resource mobilization in a quest to eliminate malaria from our country. On behalf of the government of Nigeria, the Coordinating Minister of Health, myself, and the entire staff of the Ministry of Health, I sincerely thank you for responding to our call, even on this short notice. Your continued support and involvement are crucial, and we're forever grateful for your commitment to this cause. Thank you, and God bless the Federal Republic of Nigeria.
Thank you, and I feel honored to come first on this illustrious panel. Honorable Minister, distinguished guests, thank you so much for inviting the U.S. President's Malaria Initiative to participate in this really important event and provide some remarks. I must say one of the...
Could you please, if you could move the mic to...
Yeah. It's sort of awkward to lean over.
Sorry. Mobile one. Could you get her the mobile
it's okay.
mic?
I'll work it out.
Okay.
So it is a challenge coming toward the end of such a big, large, and important event. It works. So now I don't need to bend over. Thank you very much. It is a challenge to come at the end of such an important event because so much of what I was planning to say has already been said. So I will echo some themes. I'll be a bit of a chorus to some of the key things that have come out already. And then I'll also touch on some of the things that PMI is doing here in Nigeria to support these efforts. So first, I just want to say, we actually do know how to reduce malaria morbidity and mortality. We've been hearing about it already. It's really that layering of these, I think Justin called them imperfect interventions, but the need to layer those interventions and couple that with coverage. And we also heard coverage doesn't need to be 100%. It really needs to be targeted and focused to get the impact that we need to hit that tipping point. And that's how we know you can both drive down malaria and sustain that control. We saw some evidence already this morning that that approach really works. So we saw the layering of the different interventions with the vaccine brought efficacy to 92%. We've also saw with the modeling how if you combine different interventions, you can start driving that curve down faster. And finally, even here in Nigeria, in the states that PMI is partnering with, we have been seeing a steady decline in the key malaria indicators. We want it to go faster, we want it to be better, but we are seeing that. So we do have an idea of what works. I think the real challenge that we face is ensuring the appropriate and effective implementation. And then, of course, as has been mentioned, enough both fiscal and even more important perhaps, the human resources to be able to make those changes. So a few thoughts on how we can maybe do things differently to implement better and to better use our resources effectively so we can have greater impact. So my first point is data, and everyone has said data, and I'm trying to think of a different way to say data and to say targeting of interventions. Maybe one point I'll raise is when we think of data, we do need to think broadly. It's not just health data that we need to be able to do this. We need to have our weather data. We need to have our entomological data. These are the things that are going to help us be able to not only target our interventions, but make adjustments as we are facing increased threats, climate change, biological threats. So thinking of data more broadly. So PMI is working to try to improve the routine information system and support that here in Nigeria. We're also trying to look at opportunities. We've linked our climate database with the malaria data repository here in Nigeria to give access to some of this important data to help inform decisions. Shifting over to case management, here's another point that's been made several times. Community is key. A common element across countries that have successfully reduced malaria burden is a highly functioning community health program. And I think that was mentioned on a previous panel. Well-trained, motivated community health workers with the appropriate supplies and skills have demonstrated that they can really push down malaria, reach the unreached, and importantly, especially in these times where everything is challenging, they are resilient when other parts of the health sector are disrupted, for example, in areas of conflict. So we heard about the example from Rwanda specifically. It is important, and PMI stands ready to work hand in hand and provide what thought partnership we can with the government in thinking through the rethink of the community health program. We help support Rwanda in their efforts. We've supported other countries, and we stand ready to do so here in Nigeria. Shifting to another theme, private sector. We know most Nigerians receive their initial care through the private sector. If we can improve both the quality of the care that they receive, as well as the quality of the products, it will make a major difference. In the long term, the efforts that we've heard talked about already in unlocking the value chain is going to be critical to ensuring that there's access to quality medicines, especially through the private sector. At PMI, at the global level, we work in our small part to support this by leveraging our procurement volumes, putting in those procurement incentives to incentivize our suppliers and others to manufacture in Africa. In the last 3 years, we have more than doubled our procurement from African sources. We also will see current suppliers that are looking here in Nigeria to partner with, and I heard from Dangote, maybe that's a partner, but to partner with manufacturers here to do license transfers, to also set up some production capacity. That includes insecticide nets, as well as rapid diagnostics. So we look forward to continuing to support that. In the more immediate term, there are some real innovative approaches out there for improving both the quality of care through the private sector, as well as the quality of the products that are provided. USAID is currently working to test we heard of the AMFM. It's sort of looking at that same co-payment, but it's happening at the point of service, and it's being used to incentivize testing before treatment and PPMVs. It's at the beginning. We don't know how it's going to work, but we look forward to continuing to support innovative models of trying to unlock quality of care through the private sector. Switching quickly to prevention, and here's where I'm going to talk about some tools. The vaccine. You know, we've been waiting 50 plus years for this vaccine, and we are so excited to see it be there. It can be a game changer in Nigeria, especially in reducing children's deaths, but it has to be done right. Already there is disinformation, and we saw a recent study that came out of Nigeria. They found that acceptance for the vaccine was high, But lower income groups were 5 times less likely to accept the vaccine. So we really need to concentrate efforts on how do we address that as we do this important rollout. There's plenty of other tools also discussed, and PMI is there and willing to help support that. I think I'm getting the nod that I should finish shortly. I'm almost there. I did want to mention, it's not just the tools in the implementation, it's sort of how that's done. So finally, we need to improve malaria program accountability and ownership at all levels. That's the national, state, LGA, community, and development partners. So in line with the principles of the sector-wide approach, we really need to understand how everyone here in this room, outside of this room, is working together as one team toward one plan to really address Nigeria's malaria concerns. We are willing to support, perhaps doing some deep dives at a state-by-state level to be able to understand who is doing what, funding what are the gaps, and where do we go forward, but then jointly reporting out and doing some problem solving. So thank you very much for this opportunity, and I look forward to working with you and trying to rethink malaria and implement those rethinkings.
Yeah, thank you. Let's give Dr. Lisa
your commitment to the fight against malaria and to improving the health of the people of Nigeria. Nigeria has had a long battle with malaria, and while you have made good progress, it remains a major burden of disease, accounting for more than half of hospital visits. Nigeria has the world's largest burden of malaria, with more than a quarter of the world's cases and 1/3 of the global deaths, most of them children and pregnant women. It's time to turn the tide on this ancient killer. Just a few weeks ago, ministers from high-burden countries in Africa met in Cameroon and signed the Yaoundé Declaration, committing to reduce deaths from malaria. Now, just 2 months later, Nigeria is first out of the blocks, ready to translate the political commitment of the Yaoundé Declaration into action and resources. And I'm so proud to see this accelerated action based on the declaration. We live at an exciting time with powerful new tools, including the world's first malaria vaccine and more effective bed nets. In tandem with existing tools and strong community engagement on vector control, we have a real opportunity to realize the vision of the Yaoundé Declaration. But acquiring and using these new tools requires significant and sustained resources. And we recognize that countries are operating with constrained resources and emerging threats, including resistance to medicines and insecticides, and the evolving impact of climate change. So we need a data-driven approach to identify the most effective and most equitable use of resources to accelerate progress in Nigeria and other high-burden countries. That means better financing and better partnerships. I would like to acknowledge the success of the Minister in already securing additional domestic funding for health in Nigeria. Thank you, Mohammed. We also recognize that Nigeria will also need the strong support of partners with skilled and predictable funding to achieve its ambitions. We assure you of WHO's steadfast support for a sector-wide approach, and we're committed to working with partners to ensure financial assistance is aligned with national policies and priorities. And the result, will be significant, since the country's ownership, as you can see, is very, very strong. Significant, sustained investments in malaria control will not only save lives from this one disease, they will make a huge dent in child and maternal mortality in Nigeria and contribute to long-term social and economic development. Once again, my thanks to you, my brother, Minister Mohammed Patel, for your leadership. As you said in Yaoundé, together we can change the story for families and communities across Africa. You're paving the way for other high-burden countries and showing what's possible. If a country as large and complex as Nigeria, with a malaria burden as large as yours, can win the fight against malaria, then every country can. Together, we can not only dream of malaria-free world, we can make it happen. I thank you, and back to you, moderator.